My name is Dr. Charles Sophy. I am the medical director for the Los Angeles County Department of Children and Family Services. I'm also in private practice, and I'm also the on-call psychiatrist for Celebrity Rehab and Sober House. When you hear dual diagnosis, what it means is that someone has a mental health disorder alongside a diagnosed substance abuse or addiction issue. So, for instance, someone who has a cocaine addiction oftentimes may have a dual diagnosed bipolar disorder. So you can have mood disorders, you can have anxiety disorders, you can have behavior disorders, you can have all kinds of mental health issues that are diagnosable alongside of a substance abuse issue. And oftentimes addicts have been self-medicating, really taking care of their mental health issue, and that's how they got brought into substance abuse. I believe that someone who is dually diagnosed needs to appropriately treat all areas of their life and all areas of their issues and their disorders. They need to be in a substance abuse AA kind of 12-step program, as well as a solid mental health program where they're getting the appropriate medication management if needed and the appropriate therapies as needed, so that it all integrates into one solid treatment plan to get that addict's life on track. I think that every patient is different. However, when an addict is given a prescription medication by a doctor, it needs to be an appropriately diagnosed disorder. And I think any doctor, if knowing about that addict's history, has gone through all the other ways of treating it and ending up at prescription medication as the only choice, yes, then I think it's a well-informed decision that both people, the doctor and the patient, need to be on the same page about and be open and honest about, and track it well and meet regularly, so that there is no play in that, because there are those propensities of behavior that an addict may revert back to if not tracked.